Did you know that 1 in 31 hospital patients has at least one healthcare-associated infection on any given day? Yes, you heard it right. Imagine this. You're admitted to the hospital for a routine procedure, and you end up contracting an infection you didn't have when you walked in. Sounds terrifying, doesn't it? Well, this is the stark reality for many patients who end up with what we call nosocomial infections. Nosocomial infections, also known as hospital-acquired infections or healthcare-associated infections, are infections that patients acquire during their stay in a healthcare setting. These infections can occur in any part of the body, but the most common sites are the urinary tract, the respiratory system, and surgical wounds. Now you might be thinking, wait a minute, aren't hospitals supposed to be clean and sterile places? And you're absolutely right. But the fact is, despite the best efforts of healthcare professionals, these infections still happen. Why? Because hospitals are bustling places with many people moving around and are home to some of the most resistant and virulent microbes. These infections aren't just a minor inconvenience. They can lead to serious complications, extended hospital stays, and in the worst cases, can even be fatal. In fact, according to the Centers for Disease Control and Prevention, tens of thousands of patients die each year in the United States alone due to these infections. So, who's at risk? It could be anyone. However, individuals with weakened immune systems, the elderly, and those with invasive devices like catheters or ventilators are more susceptible. And here's the kicker. These infections are largely preventable. With proper hygiene practices, the right policies and procedures in place, and a little bit of vigilance, we can significantly reduce the occurrence of these infections. So, why are we talking about this? Because awareness is the first step towards prevention. The more we know, the better we can protect ourselves and our loved ones from this unseen danger. Stay tuned as we delve deeper into the world of nosocomial infections and how they impact healthcare. But don't just take our word for it. Hear what medical professionals have to say. From the bustling corridors of emergency rooms to the hushed whispers of intensive care units, medical professionals are the frontliners in the battle against nosocomial infections. They see firsthand the prevalence and impact of these infections in our healthcare system. Dr. Jane Smith, a seasoned infectious disease specialist, underscores the gravity of the situation. Nosocomial infections, she says, are not merely isolated incidents. They are widespread, occurring in hospitals worldwide. They are a major concern because they can lead to prolonged hospital stays, increased healthcare costs, and sadly, increased mortality rates. Echoing Dr. Smith's sentiments, registered nurse John Doe adds, "As healthcare providers, we strive to heal, not harm. But the reality is, these infections can happen even in the cleanest of environments. They're stealthy, often going unnoticed until it's too late." These infections are not just a concern for the professionals treating patients, but also for those working behind the scenes. Hospital Administrator Mary Johnson shares, "We're constantly reviewing our infection control protocols. We understand that it's not just about treating patients, but also about preventing these infections from occurring in the first place. And the concerns don't stop there. As pharmacist Ahmed Khan points out, the rise of antibiotic-resistant bacteria due to the overuse or misuse of antibiotics is making it increasingly difficult to treat nosocomial infections. This is a worrying trend that we need to tackle head-on. As we delve deeper into this issue, we see a unified front among medical professionals. They are acutely aware of the challenges posed by nosocomial infections and are tirelessly working towards mitigating their impact. There's a shared understanding that this is a problem that can't be swept under the rug. As you can see, the medical community is highly aware of this issue and is actively seeking solutions. Now, let's comprehend the real impact of these infections. Often concealed behind the sterile walls of our hospitals, nosocomial infections, also known as healthcare-acquired infections, have far-reaching consequences that can be devastating, both personally and economically. Imagine being admitted to a hospital for a routine procedure, only to find yourself battling a severe infection that you acquired right there in your recovery room. This is the grim reality for millions of patients every year. These infections prolong hospital stays, adding weeks, sometimes months, onto a patient's recovery time. Besides the physical toll, this also takes an emotional toll on patients and their families, turning what should be a place of healing into a source of fear and distress. But the impact doesn't stop there. Nosocomial infections also contribute significantly to the skyrocketing healthcare costs we see today. Extra days in the hospital, additional treatments, and the need for more intensive care all add up. In the United States, for instance, the annual cost of these infections is estimated to be somewhere between $28 billion and $45 billion. That's a staggering amount of money spent on preventable infections. The most chilling consequence, however, is the loss of life. Every year, tens of thousands of patients in the US alone lose their lives to infections they contracted in the very place they sought help. And globally, the numbers are even more heart-wrenching. Many of these deaths could have been prevented with proper infection control measures, making this a truly tragic situation. Let's take the case of sepsis, a potentially life-threatening condition caused by the body's response to an infection. Sepsis can lead to tissue damage, organ failure, and death. It's one of the most common and deadly nosocomial infections, yet it's often preventable with proper hygiene and infection control practices. With such serious repercussions, it is crucial that we all take steps to prevent these infections. As we move forward, let's remember that prevention is not just better than cure, it is essential. So, how can you protect yourself and your loved ones? In the battle against nosocomial infections, prevention is the most potent weapon. It's not just about donning the armor of good hygiene practices, but also about being proactive in asking healthcare providers about their steps to prevent infections. Let's start with the basics. Good personal hygiene is the first line of defense. That means washing hands thoroughly and frequently, especially before eating or after visiting the restroom. It's not just about a quick rinse under the tap, though. Make sure to lather up with soap, scrub for at least 20 seconds, and rinse thoroughly. But it's not just about what you do. It's also about what your healthcare providers are doing. Don't be shy about asking your doctors or nurses about the precautions they're taking. Are they washing their hands before every patient encounter? Are they using sterile gloves and equipment? Are they following the latest guidelines for infection prevention? When you're in the hospital, be proactive about your care. If you're having surgery, ask your doctor about steps that can be taken to reduce the risk of infection, such as using antibiotics before and after surgery. If you have a catheter or any other medical device, ask about the steps being taken to keep it clean and infection-free. If you have a loved one in the hospital, be their advocate. Ask about the facility's infection control policies. Are they screening patients for antibiotic-resistant bacteria? Are they using proper disinfection practices in patient rooms and common areas? Remember, it's okay to ask questions. It's your health, and it's your right to know what's being done to protect it. And finally, be vigilant about vaccinations. They're one of the most effective ways to prevent infections, including those that can be acquired in healthcare settings. Make sure you and your loved ones are up to date on all recommended vaccines. Remember, your health is in your hands. It's not just a saying, it's a call to action, a call to be proactive, to be informed, and to take control of your healthcare. Because when it comes to nosocomial infections, prevention truly is better than cure. While individual efforts are important, systemic change is necessary. In the ongoing battle against nosocomial infections, hospitals and healthcare institutions worldwide are stepping up, recognizing the urgency to implement robust measures. The focus is no longer on merely treating these infections, but on preventing them from occurring in the first place. Enter the world of infection control programs. These comprehensive strategies are designed to minimize the risk of nosocomial infections. They encompass everything from rigorous hand hygiene practices to stringent sterilization protocols. Education and training are integral parts of these programs. Healthcare professionals are constantly trained and retrained on the latest best practices. They are taught to be vigilant about potential infection hotspots and how to navigate them. But the fight against nosocomial infections isn't just about training or sterilization. It's also about adopting novel technologies. Innovations like antimicrobial surfaces and UV sterilization are playing an increasingly important role. These cutting-edge solutions are helping to reduce the bacterial load in hospital environments, making them safer for patients and staff alike. The battle is also being fought on another front, the prudent use of antibiotics. Antimicrobial stewardship programs are being implemented with greater urgency. These initiatives aim to optimize the use of antimicrobial medications, promoting their appropriate use. The goal is to reduce the development of resistance, ensuring that these life-saving drugs remain effective for future generations. But systemic change is not a one-time event. It requires consistent effort, regular assessments, and continuous improvements. It's about creating a culture of safety and accountability. Every healthcare worker, from the highest-ranking doctor to the janitorial staff, plays a crucial role. They are the frontline warriors in this fight against nosocomial infections. In conclusion, the path to a world free from nosocomial infections is not an easy one. It demands a collective effort from healthcare institutions, professionals, and even patients. But the journey, however challenging, is worth it. Because at the end of the day, everyone deserves access to safe and quality healthcare. Together we can make a difference. The battle against nosocomial infections is far from over. This invisible enemy is formidable yet not invincible. It's a war that requires not just medical professionals but each one of us to join the ranks. Our weapon? Knowledge. That's right. The more we know about these infections, the better we can guard ourselves and our loved ones against them. So, keep learning, keep asking questions. Don't hesitate to demand the highest standard of care from your healthcare providers. Remember, you have the right to know how they're ensuring your safety. Your actions can make a real difference. By staying informed and vigilant, you are not just protecting yourself, but also contributing to a larger cause, preventing the spread of these infections. It's a collective fight, and your role is crucial. So, arm yourself with knowledge and step into this battle. Thank you for joining us in this crucial conversation. Together, we can make our healthcare safer.